episode of DeSci.Party. So we have got our guest today, Jack Calbi, here with us, and we're going to get into an awesome conversation about his projects and what he's been working on. And so this podcast, this show is all about exploring people's stories and just getting to know each other, having casual conversations about science to humanize the human side of science, because science can be so technical. Things that we do in Web3 and DeSci can be so technical. So it's really about just getting in there and just humanizing and getting things that are relatable about what we do and what others are doing in the DeSci space. Or for anybody who's new, welcome. If you're first just learning about DeSci, thank you for joining us. And I hope you get something valuable out of this conversation. So let's dive right into it. So welcome, Jack. Thank you for joining today.
Hi. Yeah, great being here. Thanks for having me on.
Absolutely. Yeah, no, I really appreciate it. It's been fun learning about DeSci and getting to know all the people that are working in the space. So doing a podcast is sort of a selfish way for me to get to know people better. But hopefully we can, help get the word out there about all the awesome things that are going on. I've gone full-time Web3 this year, and it's just been a wild ride. I couldn't be happier. And I think just what people are doing in the space is fantastic, like yourself. So.
Yeah, absolutely. Yeah, the DeSci space is obviously growing, and a lot of exciting things are happening. So yeah, I'm happy to share what's happening in my little corner of it.
Right, I know. Yeah, things move so fast too. It's like faster and faster.
Constantly.
So let's start off with a little background. I guess how'd you get into science? Where are you right now?
Sure. Yeah. I'm based in Rhode Island. I originally got into DeSci as so I'm a spinal cord injury survivor. I was studying in college, and on an afternoon bike ride, I was in an accident that left me paralyzed. So since then, I've been involved in fundraising for neuroscience research, mostly through the Christopher Reeve Foundation, who you might know as the actor who played Superman. And he was injured similarly in a horse riding accident. His injury was a little bit higher than mine, but he was one of the first public figures to kind of bring spinal cord injury research to the like mass audiences, to like a public standing audience. So obviously when I got hurt, I was introduced to all the kind of things that they're developing to advance, the improvement of quality of life for people who are injured in the same way I am. And there's a lot of interesting research happening, a lot of different angles. People are approaching the problem, and with varying degrees of either change or goals as far as improving quality of life, improving independence, reducing discomfort, things like that. So yeah, that's what I've been working on in the last 5 years that I've been injured. My injury happened in 2017. My introduction to the world of crypto and blockchain was happening simultaneously, but those never really overlapped until the last year or so. And I kind of found this community and realized that this technology, like the decentralized web, could be used for things like funding science. And I know there's other projects, plenty of others, who are doing things where science is being collaborated on through the blockchain. It's being funded. It's being peer reviewed. All sorts of angles. So this was my early attempt at seeing how I could apply the Web3 space to my specific realm of research.
Awesome. And you're specifically talking about Spinal Cord NFT with that?
Yeah.
Cool. Awesome. Nice. It's good background. Well, I guess let's dive right into that. And what is Spinal Cord NFT? Give me a little background at like what's the goals of the project and things like that.
Yeah. So Spinal Cord NFT it's an NFT project. I would call it an art project, no doubt. It's a what I've done here is I've taken what I'd call the artifacts from my specific injury, and I'm using them to fund the research that I'm interested in for spinal cord injury research, essentially.
Mhm.
So during the NFT craze of the last few years, I saw that digital art was exploding. You had a way of selling it, improving ownership, and you know creating royalty systems, things like that for your art. And during that time, I was also getting my MRIs done to look at my spinal cord injury, which have like going back a few years after injury, I realized, the images from the day I got hurt, which were taken in an intensive care unit,
Mhm.
um, which was a life-changing day, obviously. Those images had never been shown to me, which was curious in its own way, and I can speak on that. But more importantly, I'm just looking at these images and realizing, this is digital art, and um, I wanted to see if there was a way to make this digital art worth something and point any of that value towards the research that I'm passionate about that could help me or could help anyone who's in my situation, really. And it's been an exciting project to build. People have taken interest. I've met great people who are interested in it. Um, so yeah, really rewarding. So the project, the technicalities, I've created a 12-piece collection of the animated images of my spinal cord injury. So you can see exactly what that looks like in a human being. Um, my spine is probably more, I could say valuable or costly, depends how you look at it, than most other people's spinal cords. So it's unique in that way. The impact on me, my family, the community is large, and it's been challenging, though. You know, it's nothing. There's you wouldn't wish any kind of injury like this on anyone, but it's come with its own version of perseverance and grit and somehow meaning.
Yeah.
So yeah, I'm exploring that. We've launched the project in September, so about a year after conception, a little less. It took me that long to figure out the landscape, figure out who's out there, figure out how it all works,
Mhm.
building an NFT project, building an audience, also a brand.
Mhm.
So um, yeah, we were able to get the smart contracts launched on, I believe, September 19th this year, and they are available to mint on DeSci.World, which is DeSci.World, a project I've come to get involved with even further, and I can speak on that in a moment. But um, the exciting thing that came together for the project during the summer is that I was able to be part of clinical trials at Spalding Rehab Institute, um, or Spalding Rehab Hospital Network in Boston, Cambridge, Massachusetts. I was part of two clinical trials where I was testing medical devices for my injury. I can't speak so much on the results or what I experienced, but I can say that they were electric stimulation devices to excite the nervous system, and obviously practicing physical or occupational therapy to improve things like upper extremity motion, hand function, all sorts of autonomic functions, things like that. So what I was able to do is I gave them a call and said, hey, um, would you be willing to take donations in the form of cryptocurrency? So I was the first person to donate to the hospital, which broadly was actually the first crypto donation to any Mass General hospital. So I'm pretty proud to say that I've onboarded them to accept crypto, and
Oh, yeah.
um, I can give you the details as far as where to donate to them if you're interested. So speaking with them, I was able to get them a digital wallet address, and
Mhm.
that's available publicly. And we've written that into the contract of the NFT project, so that if you purchase a Spinal Cord NFT, the funds go directly to the lab that I was, using or participating in research at. And
Mhm.
they got a great team doing a lot of great research. So
Yeah. Damn, man. Wow. I knew it was really well done and then, impressive. That's what, your story is amazing. Hearing you tell it like that, like, wow. Um, Holy shit. Very inspiring. So thank
thank
you.
you.
And yeah, wow. Like, that is also super impressive. The custom contracts, it sounds like you didn't use just like a front end minter thing, like,
Well, yeah, that was an option for
yeah,
sure, and was originally, what I intended, but
yeah.
um, yeah, my project got listed on DeSci.World, and the guys over there have been really great as far as helping platform me, and we're kind of creating a proof of concept as like an NFT launchpad for science related NFT projects.
Mhm.
So I believe their third project listed, and so they were able to help me with the custom contracts and some of the outreach, and it's been a really great experience with them as well.
Yeah. Awesome. I know. I love that crew. Uh,
Hmm. Yeah.
wow. So they are so these NFTs and that's super cool too. They're MRIs, right? That I've actually taken a look at them. They are like super really cool to look at.
Yeah.
They're not just like a little, generative JPEG or something, it's like this is
Hmm.
intense. Like they're really cool.
Right. Yeah. I looked at them. I said, yeah, it looks like fluid art to me. I mean, it's black and white, which is interesting. And I think now that the project's out, the future iterations of the project could involve, coloring, um, more, custom creative um, work on top of the images.
Mhm.
I've also spoken with other people in the DeSci world or in the DeSci, space, who were interested in donating their medical imagery for different causes or this cause specifically. So I hope that in the future, we can expand and kind of create value out of people's medical imagery to fund their medical research.
Mhm. Yeah, that's awesome. All right, there really are so many things in the world like that where it's a touch point to turn it into something else. So MRI art, right? Images of your body. That's incredible. And I didn't even think about that recoloring them. You could do sort of like a bigger generative collection and something like that. Uh,
Yeah,
Even have some crazy image transformations or whatever.
right. I'm thinking about tie dye would be cool. I don't
Nice.
know. I don't know if you've ever seen a liquid light show. That would be kind of a nice compliment.
No, I've
Um,
never seen a liquid light. Is
like,
it? That sounds interesting.
yeah, a little aside. Yeah, in college, my roommate is a performer, and he would make liquid light shows where it's an overhead projector, and you take different, whether it's oil, water, different liquids of. Usually, you try to go for different densities too, so that there's some layering, and you can dye it, and then on the overhead projector with a kind of a clear glass dish, you can drip liquids in, and whether you're swirling it around,
Yeah,
that's a thought. I'm personally not a scientist myself,
yeah,
um, science curious, but I'm more of an artist, and I have my own um, kind of field I work in, but
yeah,
um, obviously science communications is super exciting as well.
yeah. No, definitely. Well, I would like that. That's cool. I've worked in art for a while as well. Also, just totally aside, done
Mhm.
like festival installation production and stuff like that. Building water fountains. I've done a bunch of work with water
Yeah,
and visual displays of things like that and fire performance and stuff. So I'd love to chat about that sometime. Yeah,
yeah, absolutely.
super cool. And so, are the NFTs on ETH? Are they only available on DeSci.World? Are they on OpenSea?
Yep, the ones that are minted are you can view on OpenSea. When you mint one, it will show up on OpenSea. The secondary market doesn't really exist for it yet because haven't sold out. Um, but yes, the project is on the Ethereum mainnet network. So
Nice,
yeah,
super cool. Yeah, okay. There's so many more things we can go into about this. Well, and before we jump back into that too, so we talked a little bit about art. So you said you're not a scientist. I saw you had GIS expertise on your LinkedIn and stuff like that, and you have experience with geospatial information systems, right? For anybody
hmm
who's not familiar, so it's like tell me, give me a brief background of that because there is a GIS startup in the building here, and I see them going in and out all the time with a bunch of
oh
equipment. I have no idea what they're doing.
yeah. Well, you'll have to let me know about them after this. But yeah, so my technical background is in GIS. I have a BS in geography and GIS. So I was studying that when I was hurt. And it took a few years, but I was able to complete my degree, which took a lot of support from friends and family, but I got it done. So I'm very happy and pleased to have done that. I was at Appalachian State University, beautiful spot in the mountains of North Carolina. And I finished in 2019, so I'm fairly recently graduated. I Geography was a great major because I'm an outdoorsman. I like the environment. I'm interested in climate technology. I'm also interested in urban planning. GIS offers you a way to visualize spatial data in a mapping software platform with all the analytics tools you could think of. And yeah, I've had my hand in some projects related to that since then, and hopefully getting my footing with uh, work in that field if DeSci isn't necessarily my full-time thing, which I'm enjoying. So who knows which direction I'll go, but yeah, that's a little bit about that. I'm interested in remote sensing. I know a lot of scientists um, use spatial analytics, remote sensed imagery to learn about, whether it's their environment, the way people behave, um, any kind of phenomena, ecology, stuff like that.
Nice.
I also am responsible for building the interactive web map on DeSci.World. So that's a little pilot project to get some geospatial technology to the DeSci space.
Nice. Love it.
Yeah,
Yeah, it's super
and
cool. You can look at a map and see where, different DeSci projects are headquartered, right? Quote unquote.
absolutely. And we got to get your project on there too. So
Right? There's a real lab here. This
yeah,
is not a
yeah, awesome.
background.
Perfect. We'll get you there.
uh, Super cool. So maybe let's talk a little bit about DeSci.World. So what's your role there?
Sure. So I made contact with the founder of DeSci.World, Joshua Bate. He when I was putting out feelers for my own project, and he explained to me what he was building, and this was at a time I would call pre-launch, before he had really had the full infrastructure up. And he explained, we're doing an NFT platform, information aggregation for the DeSci space, give people a place to interact, communicate, get involved. So, that seemed like a logical spot for me to, find my niche and um, get myself out there to the world and also see what else is out there. So in tandem of building Spinal Cord NFT, there was work to be done on the platform itself. So I've gotten involved with that, and I worked on their product team and their outreach team. So I do a little bit of everything. I'm a generalist, but my most recent project was the interactive web map, which is very visually pleasing and exciting to it really did fit with the ethos of the DeSci.World project in general. There's a whole world out there, and when you have a way to graphically map that, you know, you can see there's a lot going on, and I have my own little spot there, and he helped me do with the contract, and I've been somewhat of an ambassador for my own project and DeSci.World simultaneously.
Nice. Yeah, I mean, well, that's part of the DeSci.World platform, right? Is the NFT Launchpad, right? So
Exactly.
they've got the dashboard, which lists different projects. They've got the NFT Launchpad. There's the map.
Hmm.
Some cool stuff.
Yeah, and this past September, I was at the DeSci Boston event at MIT, which was very exciting. Boston, Cambridge are definitely a hot zone for all sorts of research, and whether it's academic or a lot of biotech
Mm-hmm.
happening there. I was a little bit out of place, but it was great meeting everyone, and finally meet people in person, which is tremendously valuable. I obviously love that you can connect to the world and meet all these folks digitally, no matter where you are. But when an event comes near your home, you're gonna take advantage, right?
Definitely. Yeah, that's cool. How was that? Like the event as a whole? Like, what were your favorite talks? Or
Oh, it was fun. Yeah. Yeah. Let's see who was there. All sorts of projects that are currently listed on DeSci.World. You
nice,
can,
nice.
yeah. We can drop a link in there in somewhere
Yeah,
where this is posted.
yeah. This
To
is YouTube, so I'll have stuff in the description. I'll put some links in there for sure.
awesome. Yeah. So there's recaps of that event if you want to take a look.
Nice.
Yeah, it's good networking with people, seeing what everyone else is doing. It's great to hear what you're up to. So yeah,
Yeah, definitely.
positive experience.
Right. DeSci has come a long way. It's just honestly been like less than a year of real good activity taking off, right? I think DeSci at what was it, ETH Denver 2022, right? That was back in February. There was a lot of hubbub about that, which honestly I was in Denver at that point, promoting a DeSci project, had no clue about it and what they were doing over there. And so, in the past 9 months or so, 10 months, yeah, I've definitely dived a lot more into that space. Maybe I just wasn't aware, or maybe the connections in the community, for DeSci itself, hadn't quite reached that critical mass. But definitely,
So,
I feel like it has now.
so did you end up attending that event?
I was at ETH Denver, and so I went to help produce DAO Denver
Okay.
with DAO Planet, and then went to the actual ETH Denver event over the weekend. Didn't participate in the hackathon. It was just I was there to meet people and connect, and I went to a bunch of talks, so that was great.
Awesome. Yeah, I hope to if there's another DeSci event at ETH Denver, I'm trying to be there.
Nice. So you're gonna go this year?
I don't have plans to at this moment in time, but I could log off today and see what I can pull together.
Great. Right. Yeah, it's coming up in a few months.
Yeah,
Uh, I don't have any concrete plans yet, but yeah, I definitely want to be there.
sure.
Yeah. So where about, I mean, maybe give me your perspective on DeSci as a whole then, as we start to like zoom out a little bit. What do you think, where are we now? What are the biggest problems we're solving? What do you think what's your perspective on DeSci?
Yeah, I think we're reaching a pinnacle point of it seems like there's larger institutions taking notice and getting their hands in the mix. I don't know if that's always what the space. I don't know if that's critical to the success of what's happening, but it is nice that they're recognizing what people are doing in a decentralized way without the backing of the ivory tower institutions, right? I heard from Molecule that Pfizer is getting involved in their medical DAOs, which is pretty interesting. I don't think that they don't, you know, I think everyone deserves to have a seat at the table. So it is cool to get just some mainstream um, recognition, right? Um, I think there's a lot of interesting approaches to things like rare disease that are coming up. Particularly interested in Vibe Bio, which is based out of Cambridge. There's other projects. I realize there's, let's see, biotech is, by life sciences, biotechnology is a dominating force in DeSci, but that's also true of science in general, just because there's the most stakeholders in life science. It's got the biggest, market. People need, you know, solutions to their health problems. It makes sense. Um, so another project I'm very interested in is Data Lake, which is listed on DeSci.World. You can look up Data Lake. I believe they're based in Poland, and they're looking at creating a database of donated medical data from patients, and using Web3 technology to make the donation of that seamless as far as privacy and then rewards, and um, something to look into. Um, I think there's a ton of opportunities for other citizen sciences, which might not necessarily be biotech. Um, if I could share with you, actually a good application of geospatial technology, and maybe even potentially in like DeSci and Web3 citizen science, I can tell you about the Audubon Society, which they do. They study bird populations. All of that data that they have an app called eBird, which is all that data comes from recreational bird watchers who are spot a bird, cite it, say its location, and you can say how many you've seen, or and I think there's going to be really interesting Web3 versions of that, where people are generating data for these networks and being rewarded for it, so that you know the knowledge pool can grow, hopefully exponentially, and people are encouraged to be involved in science. Sometimes even if they're not a scientist themselves, like me, who that makes it worth it. If I can be involved with science, I don't need to be in a lab necessarily. Which, I mean, I'm not saying anything wrong with being in a lab. I'd do it if it was my forte. But yeah, just broader participation is interesting.
No, definitely. And that's interesting. I always hear people say that I'm not a scientist, and like everybody's a scientist, you know?
Sure. Yeah.
Because science is just a process about discovering facts about the real world, right? And ultimately it's a way to suss out what's BS and what's not, or what's got at least what's plausible, or versus what's got support or what doesn't. And especially in today's modern world with so much stuff flying around, it's definitely important. I think it's as science education improves, it all goes back to me for education. As science education improves, and it becomes just sort of a general part of our adult literacies, how do you determine whether something about the world, a statement about the world, is true or not? And that comes down to so many different levels. Obviously, journalists and other people do, have different processes and ways to do things like that. But the scientific method, I feel like, is so powerful, and people get hoity-toity and stuck up about defining the scientific method and having a hypothesis. But ultimately, I think anybody, people run their own experiments in their lives, and yeah, so really, that's something I love about DeSci, is that it's sort of kind of like how open source software like brings the community with like directly to the developers, enables that like feedback loop for growth. Like DeSci sort of does that with people, the users of science, right, and scientists who are doing the science or whatever, but ultimately sort of bridging that gap.
Yeah, I guess now that you say it, I am a little bit of a scientist.
Yeah.
My hypothesis was, well, I don't know if I'm phrasing this correctly, but can you sell your MRIs on the blockchain to fund science? And the answer is yes, you can do that. That's the concept has been proven, I'm proud to say. So obviously, I would love if listeners here would take a look and patronize DeSci.World and consider minting an NFT of mine. And again, that'll fund the Inspire Lab in Cambridge, Massachusetts, which I'm very passionate about, obviously. But yeah, I phrased it as a Web3 experiment. And I found, if you decide that you want to do something, like if you consider it an experiment that could go either way, like
Yeah.
it's a success either way, it proves something.
Right. Yeah. Negative data is still data.
True.
Another problem with bias that hopefully DeSci can help fix, the publication bias. Right?
Yeah, absolutely.
Yeah. Cool. So yeah, so we've zoomed out a little bit on DeSci. I guess let's talk a little bit more about the long-term perspective on where I guess you see DeSci, not DeSci, sorry, Spinal Cord NFT going. So we talked a little bit about potentially expanding the collection or working with other people. I know you had a roadmap on the website the last time I had checked. I didn't get a chance to check this morning, but I don't know if you want to talk anything about the aspects of the roadmap or things like that.
Sure. Yeah. It's evolved, so forgive me if my explanation isn't exactly the most updated, but there were a few goals of this. So first is to raise funds for research in general. That's a key point. A second one, which evolved after having like kind of created the brand, was to onboard organizations into accepting cryptocurrency. So when I was, I had the idea, I had the images, and I said, how do I, what lab or organization is going to get the money if I were to make any? And it took some time to narrow down, who's going to be the beneficiary that satisfies, some of the, the criteria. I realized that they were, the people I had spoke with hadn't ever really had any exposure to the NFT space or the blockchain space in general. I think there's a lot more happening now with um, this kind of movement of crypto altruism, which has some overlap with DeSci. People wanting to be philanthropic and use the blockchain to do it. So I made some calls to different organizations to be recipients of the funds. Um, and obviously, the Inspire Lab was the one I landed on. They were the easiest and most cooperative as far as like, yes, we are working on getting a digital wallet. We want to accommodate this donation from you. So and plus geographically, they were the ones who would benefit me personally the most. Um, you know, I am an interested party as far as the science is going to benefit me, but
Yeah.
the research they do will benefit anyone in general in my situation, anyways. But I just had a relationship with those folks. So circling back, basically, another goal on the roadmap is to explain the project to people and encourage the organizations who are doing this kind of research to start thinking about using crypto donations and creating their digital wallet, and maybe even using NFTs as a fundraising mechanism.
Mhm.
So the third point on the roadmap is most likely seeding what I would call most likely a spinal cord injury DAO of some kind, and that's still in the cards now that I've seen what the project has succeeded at and what it hasn't, and now I'm looking at other resources and seeing what other people are building. I think I could definitely be a core contributor to that kind of thing, and I'm speaking with, people who are maybe interested. That has yet to be gotten off the ground, but hopefully in the future that's something we accomplish. And I feel like I should also dive into a little bit more about what the research itself, what's happening in spinal cord injury research in general. Why don't I explain some of that?
Yeah, please.
Yeah. So the idea is, if you sustain a spinal cord injury, most people are told that their whatever condition they're in is most likely going to be permanent, right? You hear the trope that, like, you're told you're never going to walk again, which is the case for many, unfortunately. And the idea is to, break down that preconceived, diagnosis, I guess,
Mhm.
uh, and, offer therapeutics that could improve people's lives, whether it's like, sensory or motor function. And if you ask people with spinal cord injuries, like, what's the top thing you'd want to improve? It's actually pretty much never walking again. There's plenty of other, like, autonomic functions that people struggle with that, even if you're in a wheelchair, like, the wheelchair part's not always the worst part. Um, I could go into, you lose your ability to, like, regulate your body temperature, your ability to sweat, which um, interestingly, I regained after the clinical trial I participated in.
Wow.
Super interesting. I don't know why that one worked, but it did. Um, you have trouble with, digestion, um, you know, um, all sorts of things, really.
Mhm.
Uh, and if you could improve on those metrics, then you might improve independence without ever having really, um, you haven't gotten a paralyzed person to walk, but still made a measurable impact, which is tremendously valuable, especially since you can't walk and all these other problems on top of it, right?
Mhm.
Um, so what they are doing, and some of the research that the Reed Foundation is funding, I would say the Reed Foundation is probably the biggest fundraiser in this space. Um, there's You might know about, like, brain computer interfaces. They're doing a lot of work in the spinal computer interfaces,
Mhm.
where interesting projects where they put um, electrodes into the base of your spinal column, um, along the spinal cord. The first iterations were just like a single electrode,
Mhm.
and now they're doing um, arrays of targeted electrodes to different muscle groups. Um, what I tested was an electric stimulation device, and I would call that like an external, non-invasive, singular channel device. And I would call that, yeah, non-invasive, pretty low risk. Um, the next iteration of those are going to be, obviously a surgery, which if they prove that it's safe and effective, would most likely be worth it,
Mhm.
folks. And what they can do is, and there's already people who have proven the concept. Um, with these multi-channel electrodes is they can time the shooting of electricity into each specific channel by filming someone in a harness with physical therapists taking steps for them with their feet and
Okay.
synchronizing the video and using AI to like line up the muscle contractions as you're walking on video. If you ever seen,
Whoa.
cool, it's futuristic. It's the dreams of sci-fi folks, and it is an extremely exciting feat. Like I almost equate like if you can get a paralyzed person to walk again, that's kind of like getting someone to the moon, right?
Yeah.
Like, it's like getting someone completely off their feet and back on, and you know the science is cool and it's exciting. It's a big milestone to like see if humanity can reach in general. So we'll see how that goes. I know of trials starting in the U.S. for that device specifically, probably in the next year or two.
Hmm.
Um, Other things they're working on in spinal cord injury research are things like cell therapy for at your injury site.
Hmm.
Um, there are things like gene therapy and basically anything that you would do is going to be a combination therapy with lots of physical therapy and OT, just part of the process.
Right.
And everyone understands that. Um, there's some cool stuff happening, yeah, as far as hydrogels, protein combinations, things like that.
Hmm.
And here's where I myself am not one to give you the best explanation, but I think you understand the gist. Is you know um, there's the electric component because we have electric nervous systems, and then there's also the drug therapeutic injection kind of approach. I know there's also been um, work on exciting the nervous system and function through um intermittent hypoxia and even um, compounds related to uh, caffeine, which is interesting. I don't think caffeine itself has been proven to be effective, but I think people are working on uh, different research involving like a closely related compound, right?
Hmm.
Um, I'll have to find the name of that for you. But there's cool stuff, and I'm basically around to just try it all. I'm happy to be the guinea pig. So if I'm not the scientist, I'll be the test subject.
Nice.
Yeah.
Yeah. Wow. That's a lot. And I worked in regenerative medicine in grad school. So yeah, my mind is racing when you're talking about like hydrogels and proteins and
Hmm.
different ways to I guess and that's probably what they were doing, trying to do is re-stimulate nerve either growth either with the cell therapies or something like that. They're probably trying to, right, they're not like injecting whole neurons and like doing a micro nano surgery, right? They're trying to get the existing cells to try to regrow or reform connections.
Exactly. Yeah.
Yeah.
One of the barriers really is like if you can regrow nerves through scar tissue.
Yeah.
So a lot of people who have spinal cord injuries, depending on how they're hurt, um, their spinal cord isn't severed.
Hmm.
Unfortunately, things like gunshot wounds are often the kind where it's more likely that your injury is severed or your
Hmm.
spine is severed. Whereas, like for example, mine is technically incomplete. Um, the furthest end of incomplete, as close to complete as possible, but still not. I have some sensations below my injury, and I have some movements below my injury. Though, you know, can be a blessing and a curse because in that situation, you might be in a lot more pain than someone who's just lost all sensation.
Hmm.
Uh, but it does indicate that, you know, and you can look on the spinal cord injury, spinal cord NFT. You can take a look at my specific spinal cord, and you can see that my spinal cord is there and intact. Um, the difference between the day of injury and the few years out is that the spinal cord swells and then decompresses over, the years following. So that'll, the follow-up images haven't been released, but that's essentially what you would see. And you can see that in those images, the spine's connected all the way down. It's just that one little space that it's just covered in I don't know if you'd call it gray matter. Really, it's scar tissue, and it's visible. So,
Hmm. Wow. So does the spine actually scar internally?
yeah,
Yeah.
essentially,
Yeah.
and there can be living neurons inside of those. The neurons are there. It's just the action potential, I guess, isn't quite high enough to get through, and
Right.
that's what a lot of these like electric therapies are doing.
Yeah. Yeah. It's interesting to think about because there are some animals like lizards that don't scar. That's kind of what that was
Mm.
the thing that I was studying in grad school was how do these animals that are relatively in terms of the grand tree of life pretty closely related to us, right? The vertebrates, they've got pretty much the same cell
Yeah,
types, right? The same signaling mechanisms and things like that, but they activate them differently. And when they get a massive wound, either they lose their whole arm, right, or lose their tail, which
they
is
can
essentially
regrow, right?
they can regrow it because it heals over as just like normal skin, and then
Mm.
it'll reactivate the developmental processes that normally occur during embryogenesis and development, and they'll be like, okay, grow a tail here, and it'll grow out.
That is, yeah, that's a secret to unlock.
Yeah.
I know I see a lot of articles about, tell me if I'm pronouncing this right. It's called an axolotl, or
Mhm.
is that the right pronunciation?
Cute little lizard with the things. Yeah.
Yeah, yeah, these little like regenerative little lizards that um, I don't know how far along that work is, but it's definitely interesting. I know there's also I've heard things about like jellyfish, whatever gene expression they have that keeps them immortal. They're trying to use in regenerative therapies, and I've heard of it being applied to spinal cord injury. Most likely at this point in mice rather than humans, but we'll see.
Mhm. Yeah, stuff takes a while to get to the clinic, obviously, because it's so complex. And what if you activate the wrong developmental program in a person? Well, then that could basically be cancer. Um, so it's interesting to see this sort of stuff move from basic research into clinical application, but hopefully soon.
Yeah, and that's been a big challenge. The FDA Valley of Death. Um, Not that it's not. I don't blame the process because you need to verify and everything. But I think a lot of therapeutics are kind of in the pipeline, and getting it from proof of concept into the clinic is that's a long process. And actually, the Inspire Lab has their hands in doing in you know working through that process. So I'm happy to be supporting them.
Nice. Cool. Let's see. We've covered quite a lot today. Um, we talked about the roadmap. We talked about where it's going. Anybody listening, there are still some NFTs available in that Genesis
Yes,
collection.
absolutely. So go grab one if you can.
Right. Let's see. Are there any sort of final closing thoughts you have here, Jack, about um, what you want to see in the DeSci space or anything like that?
Um, I would say I'm just excited for its continued growth. You know, I I'm glad to have found the community. Community is makes it. Um, it allows someone who's not a you know I guess I am. I guess everyone is a scientist, but if you didn't think of yourself that way, then you can begin to at least. I think in pop culture, I think sci-fi is huge, and people are finally, well, they have been, but even more so, people are able to just get involved in futuristic things happening. I think there's a lot of problems to solve in the world, and DeSci might uniquely be positioned to tackle those things, in ways where the incentives weren't right before or the participation wasn't right. People are kind of seeing, the decentralized movement in general is offering people a way to opt in or out of, you know, society in different ways. And if there's this kind of infrastructure and community, it's just really cool and, fascinating. So it piques my interest, no doubt.
Definitely. Likewise. As
Yeah.
evidence.
Hmm.
Awesome.
So,
Well, cool. Thank you so much, Jack. This has been a wonderful conversation.
yeah, great being here. Thanks for having me. I'm excited to see how things work out for you and DeSci.Party. I'm wishing you the best of luck, and I'm honored to be your first guest.
Honored to have you. Big time. And yeah, for anybody watching, there'll be information, links, and details in the description of the show on YouTube. Thank you for tuning in, and we'll see you on the next DeSci.Party.
All right.
Yeah.